Hi, welcome to a conversation about migraine, insights on how to talk to your doctor about your migraine management. I am Jennifer Bomberger, Senior Director of Strategic Partnership at Midscape Education, and it's my pleasure to be your moderator for this afternoon's program. Midscape is thrilled to be partnering with the American Migraine Foundations to share insights from our programs, patient and clinician perspectives in the use of modern therapies for the management of migraine, and optimizing treatment for the management of migraine. These programs were developed in collaboration with both the American Headache Society and the American Migraine Foundation, and were presented to neurologists and headache specialists, other clinicians at the American Headache Society meetings in June and November, respectively. Before we begin, I want to take a moment to recognize Eli Lilly for their support of this program through an unrestricted educational grant. This afternoon is to provide insights from the patient and clinician perspectives and address critical questions about how to develop a shared decision-making model for managing migraine. I want to welcome today's presenters. First, we have Dr. Christine Lay. Dr. Lay is a professor of neurology and the founding director of the headache program at the University of Toronto. She's actively engaged in advocacy and education, serving as the vice chair of the American Migraine Foundation, and is a board member of the American Headache Society. Dr. Lawrence Newman. Dr. Newman is a professor of neurology at NYU Grossman School of Medicine, the director of brain health at Atria in New York City, and the chair of the American Migraine Foundation. Rachel Koh, MBA, Rachel is a patient advocate who serves on the board of the American Migraine Foundation, or the American Migraine Foundation Board of Directors. She has lived with chronic migraine for over 30 years, is a wife, mother of two, and participates in the International Headache Society Global Patient Advocacy Coalition. Cherise Irons is a chronic migraine patient and advocate. She is a leadership and perseverance coach who inspires individuals and teams to serve and lead with confidence. Cherise tells it like it is, and I can attest to that. Yeah. Sharing truth and stories people need to hear to go from surviving to thriving. She is also an AMF Emerging Advocate graduate. Kaitlin Hall. Kaitlin has had chronic migraine for about 6 years, and during that time has advocated for herself to over 20 physicians. She's passionate about migraine awareness, joining the American Migraine Foundation's inaugural Emerging Advocates program in the spring of 2021. During that program, she worked in a team of advocates to design an advocacy project to increase accessibility, awareness of migraine as a disability in higher education institutions. As a PhD student, she continues to work to improve accessibility of education to people with disabilities. Welcome, everyone. Thank you so much for joining our program today. Say hi to the audience. Anyone?
Hello. Hello.
Hi. All right, housekeeping items. So before we get started, the information provided during today's chat is meant for educational purposes only. It should not replace any advice you receive from your headache specialist, neurologist, primary care provider, or any other healthcare professional. If you have questions about your specific care, please reach out to your healthcare professional. The American Migraine Foundation is an amazing organization and has incredible resources on how to live and navigate migraine. I can specifically recommend one of their guides related to this discussion called Talking to Your Doctor About Migraine. You are encouraged to contact them by emailing info@AmericanMigraineFoundation, all one word, .org, to discuss other questions, receive support, obtain resources to support your care, treatment, and engagement with your medical team. There were many insights that came out of the presentations we did this year that we're going to discuss today. I'm going to start off by picking on Kaitlin. So, hi, Kaitlin. For the audience,
for having me.
Today, there she is. For the audience today, in a few minutes, would you describe the journey you've gone through the past 6 years being diagnosed with migraines, and any tips that would be helpful for someone newly diagnosed to know going into their doctor's appointments?
Of course. So I've learned a lot over the last 6 years.
when I first started this journey, I was actually 18 years old. I had just shipped off to college for the first time and was navigating that sort of new life, and also trying to navigate suddenly having these headaches appear out of nowhere and having other symptoms like, difficulty with my speech or difficulty, with coordination and walking. And, that was really scary. And so I went to a doctor just to try to begin the conversation of, what is this thing that's happening to me that's impacting my quality of life, impacting my ability to do the things that I want to do. And I really didn't know how to have that conversation. I kind of just walked in and was like, hey, I have this problem, help me. And unfortunately, as I've learned talking to more and more physicians, that unfortunately doesn't give the physicians very much to work with, right? So I started to learn that the more detail I could provide, the better. And I specifically learned that connecting with my physician by really explaining, here is exactly how this is affecting my quality of life. And so I learned strategies like paying attention to how many attacks I was having a month, how many pain days that I was having, what kind of symptoms was I having in addition to the pain, like I mentioned, having dizziness and difficulty walking. How bad is the pain? Like what level does it get to at its worst? And, just really kind of took a data-driven approach. I mentioned I'm a PhD student and also an engineering student. And so I think this kind of fit within my wheelhouse of skills. And so, but it really helped my physicians understand how debilitating this was for me and also understand, okay, what are we dealing with here? What kind of migraine is this? Could it be something else more serious? And so that really got me to a place where we could begin to try medications to help, improve my quality of life.
Dr. Newman or Dr. Lay, whomever wants to talk, is that a common experience you hear from people when they finally come to you, that they're having trouble explaining their symptoms, getting the care they need? And what questions as a headache specialist do you like to see from your patients?
I'll start, and Christine, you can follow if you'd like. So, unfortunately, Kaitlin's journey is not that unusual. To begin with, it's difficult to get an appointment with a headache. Get an appointment with a headache specialist. Want to have appointments available? There's just so few of us in the country that exist. So, because of that, time is of the essence. So it's really behooves the individual coming to the doctor to be prepared. To know, and Jennifer, you had discussed about the scripting tool we have on our website, which is very useful. If we're going to ask questions and you're going to have the response, I don't know, I haven't thought about it, you've wasted all this time waiting to see us, and then you're limiting the amount of information you're giving us to make a decision. So preparation is really key to make sure that you're your own best advocate for your own care.
Yeah, and I would just add, I think, as we tell all our patients and many people with migraine know, make an appointment to specifically talk about migraine with your primary care provider. Don't mention it in passing with something else, unlike a lot of other medical conditions where the doctor can just examine you and figure out what's wrong. Your blood pressure is high, your eyes don't work right, or I'm hearing something on your cardiac exam. Migraine is all in the story. And so, as Dr. Newman said, we really encourage patients to be prepared, to be persistent, and, to kind of be an advocate for themselves. And from the physician side, we're always encouraging physicians to advocate for themselves in terms of learning more. So, despite the fact that headache, migraine is exceedingly common, it's really not well taught in medical school at all. And even in a neurology program where headache is the most common neurologic problem, it's a very small part of the 4 to 5 year residency that residents spend in headache. So, to be fair, many doctors out there just don't have in their toolbox what they need. And so we encourage them to go to our partner, the American Headache Society, and maybe to even look at some of the patient toolkits on the AMF website. And that helps both sides be better prepared.
I would add as a patient, so I am post 30 years with migraine and misdiagnosed for multiple years in advance, which led me from episodic to chronic. And so I would say being prepared to go to a doctor, um, trust your gut as a patient and ask the questions. And if your primary care doctor is saying, oh, you just have a headache, if you feel like it's more than that, then you should seek a referral to, as we've talked about, a headache specialist, but at least a neurologist. And with that said, I have also, beyond giving my medical history in my first appointment with multiple neurologists over 30 years, I have taken on the task of myself to come up with my top 3 questions to try and focus the conversation. And I'd love to hear what Dr. Lay and Dr. Newman think about that. I mean, medical history is very important, and it could just be a run-on conversation for multiple hours with you being a clinician and me being a patient. I want to focus you. So I've really spent time before every doctor's appointment, not just with my neurologist, but now I take that as a general practice to come up with my top 3 questions to focus the conversation. And of course, that leads in multiple places, but at least it focuses the conversation.
I completely agree with that. I think focus is key, and while we all want to get better, you will have a stronger relationship, and you'll make more advancement if you come in and say, I want to get better because this headache is particularly disabling. I've missed so many days of work because of it, or I currently have not that many migraine attacks, but the medicine I take to turn off the attack isn't working very well. So I think that's a great suggestion, Rachel, to be prepared and focused with your top 3 needs or questions that you want addressed. Otherwise, it's just a big bubble of, I want to get better, but getting better means different things to different patients, and it could mean something different to your provider.
Yeah,
Yeah,
just building on that, Jen, is one of the important things to bring up to the clinician that you're seeing, and I'm saying it as a clinician. Doctors don't ask volunteer just how disabling this condition can be to them. If you downplay it, you're not going to get the type of treatment you deserve. So be honest. Don't just say, oh, it's nothing terrible. It is something terrible. And you have to advocate for yourself in order to get the best condition. And if your doctor is not responding, or I should say your caretaker is not responding to your needs, look elsewhere. Don't just settle for that.
and Cherise, I know you've had some experience with that in trying to like optimize and find the right doctor. Do you want to share a little bit about your experience?
Hi, good afternoon, everybody. Sure, Jennifer, I can do that. So I agree with that's definitely true. I've definitely had my journey has been, long, and I mean it's been over a decade or more that I've dealt with migraine, and I've certainly been on a journey trying to find the right professional to help me. And like Dr. Newman just shared, oftentimes, you don't always run into the right and compassionate person. And I've done the whole bring the question thing with me now, and gotten to asking the right questions. And I've run into some people that are not exactly professional. They don't always ask the right, they don't answer your questions. They disregard your questions. And now I've had the right neurologist now, but I've been in situations where I didn't, and I've had to fire those people. And one of the things I want to emphasize here to patients is that you are your best advocate, and you live in your body. You are the person that knows what's best for you. And you should not be afraid to say, listen, this isn't working for me. It's not working. It's not really helping. This medication isn't working. I'm feeling this. The doctor doesn't really know. And if you feel like Dr. Newman said, if you're not being heard, it's okay. You don't have to go there. There may not be a lot of neurologists, but I promise you, there are doctors and neurologists out there who are willing to listen to you. And as evidenced by the 2 that are sitting here, they're not the only ones. So, you have the ability to say no. You have the ability to find someone who is willing to help you. AMF has literally a place where you can find the doctors. There are people that exist. And I know a lot of my peers in the Move Against Migraine community that actually there are people I know that travel to go see doctors. And I know I'm hearing people say, but Cherise, I may not have the finances. I may not have this. I may not have that to get there. But is it what's worth it to you? You know, what's more important is for you to get the best care, and you have the right to tell someone, listen, you don't have to take it. So, I mean, you know, you have the right to do that.
Actually, taking off of Cherise's comment about traveling and expenses, Dr. Lay and Dr. Newman, I wonder what telehealth is doing these days. I know with COVID it was very big, but now it's limited to if you live within the same state. So I wonder what your perspective is on telehealth.
I think it's critically important. It changed the landscape of healthcare. And I think patients and physicians, particularly in the field of headache, are really trying to advocate to maintain and build the telemedicine programs because, you know, you may not have time to travel. You may not have the resources to travel, as Cherise said. It's very costly. And it really, we need to be able to access those parts of the country that are significantly underserved in terms of headache management because there's no neurologist in the area. There's no headache specialist for hundreds of miles. So I think telemedicine is key. American Migraine Foundation published a little while ago now, Larry, on this, showing that it really enhances care. Patients like it, physicians like it, and it works.
Thank you so much. That's perfect, Rachel. I'm so glad you brought that up. I'm going to flip the conversation just a little bit or take it a little bit further. And I'm going to start with Dr. Lay and Dr. Newman, or Dr. Lay first. How do you work with the patients to come up with what their treatment goals is? And then once we hear from you, we'll flip it back on our advocates and we can talk about how that conversation goes is what are your treatment goals? Because not everybody's are going to be the same. Optimizing the treatment and then optimizing that conversation. So Dr. Lay.
Great question. And I think a key question to ask every patient that you meet, not just every new patient, but every time you even see the same patient in follow-up is, what do you want to get out of today's appointment? Because some individuals, you know, we all tell the stories, these sort of criteria you have to meet, where you have to have a 50% reduction or we won't renew that medication. We all have patients, you all have colleagues and friends who will say, I used to have a daily headache that was so disabling, I could not go to work. Now I have a daily headache, but I can go to work and I can function and I can participate in life. But according to an insurance number, you know, there hasn't been a 50% reduction in days of headache. So I think it's really key to find out what your patient wants, because as a physician, we may think that there's a different goal in place. So coming up, as Rachel said earlier, and all the team have said, focus goals on what you want for that particular appointment and being flexible, because it may change each appointment. Some patients do very well in the winter time, but when they check in with the doctor in the spring, they need a different preparation because summer's a bad time for them. And maybe they need to go back on the preventative that they didn't need in the winter time. So we have to be flexible. There's a lot of art in headache medicine, which we like, and it allows us to tailor to patients. But as Cherise said, and Kaitlin and Rachel, as a patient, you have to push to get to the right physician who will listen. And Larry, I'm sure you have other things to add.
Yeah, and it's hard to add anything to what you just said, but I would also say you need to advocate for yourself. And you also need to approach the visit as Christine said, what you want to get out of it. But there are two types of patients. There's lots of types of doctors and clinicians. There's two types that be actively involved in their care. And then there's the passive type that says, help me, and don't want to be involved in your care. And I can't say strongly enough, the people who are actively involved in their care get better. What you want, it can also be what not only do you want for you, but what you want for your friends and your family. And I spend a lot of time in my clinical practice talking to the spouse, talking to the children, talking to the caregiver, talking to the school, to let the people surrounding my patient know what exactly they're going through, that it's not just a bad headache, that this is a disabling disease that affects them and you and their ability to work and their ability to go to school. And you need to rely on your care. You have to ask for it because it's not always going to be offered, but don't be shy. You're waiting for this appointment to get better. Be involved in every way you can and have your clinician be involved to get you there.
Dr. Newman, thank you for bringing that up. I don't want to be too vulnerable here on this call, but my husband and I have been through therapy. He's a doctor. He's very empathetic and open to, health issues, but there's nothing like becoming a caregiver when you didn't expect to. And so significant others, children, I'm a mother of 2 boys who have inherited this disease. I'm a daughter of a father who didn't know he had migraine until I got diagnosed and started taking medication, and at 70 years old started feeling better. I think it involves the whole family, and advocating for yourself, like you started off with, Dr. Newman, is so incredible. But also think about the people who love you and who are watching you suffer as a patient. To all those patients out there listening, there are other people in your life who are concerned and who want to help, and they just want to try and make a difference. And to even inviting them to a doctor appointment as an advocate to take notes, anything you can do to really involve your circle of the people who love you is really critical, not only to yourself as a patient for the support network, but also to the doctor, the clinician who wants to hear maybe symptoms that you didn't recognize, but also for them to feel like they have a plan to try and help.
And I'm going to actually bring this to Kaitlin because I know she's had a unique experience where she's had to advocate for herself in an educational system. And I bet we have some people on the live that are watching that are having to go through the same thing. So how do you explain to your peers and your professors or your teachers what you're going through? And this is just like Dr. Newman said, not a bad headache. And I'm going to let you talk about your experience now.
So, I'll open this with it's hard. It's a really hard thing that, is a constant ongoing process. I think that was one of the misconceptions I had was like, okay, I just have to tell these people in my life once and then we'll just kind of move from there. And, it's an ongoing conversation about how it affects me and what kind of accommodations I need. So I think fundamentally the most important thing for anyone in an education system, whether it's K through 12 or whether it's higher education, is to seek help from like disability services, or in K through 12 if you get a 504 plan. You really, I felt a lot of internalized shame about that, I think a little bit, because I felt like I wasn't, quote unquote, disabled enough with my migraines to like deserve these accommodations. And, it wasn't until a professor kind of sat me down and said, look, this levels the playing field for you. This allows us to be fair to you in a way that enables you to succeed. And that is something that you absolutely deserve, is the tools that you need to succeed. And so both at my undergraduate institution and now at my graduate institution, that was the first call I made, was to disability services. And I don't want to get too much in the weeds here, but the type of accommodations that they can give you are things like, flexible attendance. They can change your working environment so that you can be in kind of a dark space as needed. And so it's been a huge benefit to me to be able to have that support, and also to have that documentation so that I'm protected under the Americans with Disabilities Act. So that's one piece of the puzzle. The other piece of the puzzle is kind of what we've talked about here, what Rachel has brought up about the people around you who care about you. And so in my working environment, those are my colleagues and my professors. And so while you are not required under the Americans with Disabilities Act to disclose what your disability is, I have chosen to do so. And the reason why is because the more that people understand how this has affected me, the more empathetic and compassionate they've been able to be towards me. And so, I understand that there are some people who don't feel comfortable disclosing their disability, and you absolutely have that right. I wish this was as much of an issue as it is. But I will say, the more I've disclosed and the more I've gotten people to understand, that this is not just a headache, as we, the common refrain, this is not just a headache. The more compassion and support I've been able to get from everyone in my department.
I would just add to that. That was excellent, Kaitlin. American Migraine Foundation has partnered with the International Headache Society Global Patient Advocacy Coalition, and Rachel is a key member of that coalition. We've created a Migraine in the Workplace program. And we work with corporations, and essentially we're not just saying, oh, you have migraine, come to the program, but it's for everybody in the company. So the people at the top, the people in the middle, the people at your level, the people below you, whatever, every single person can participate in this program, learn about migraine as a disabling brain disease, understand the stigma and ways to help. And the first company that completed it, Fujitsu, a very large global corporation, found it incredibly helpful. Over 90% of participants felt like this was a great program and needed to be shared. And in the end, the bottom line, the company will save money by doing a better job understanding migraine. So it works for everyone.
Can I just add a clue, Jen? Can I just add a tip, I should say? And I'm saying that because everybody on the screen, besides those of you watching, everybody on the screen lives with migraine. And one of the things that we do as a person with migraine is we downplay our illness. And when you go to the doctor's office, I don't want you, because you're doing yourself a disservice, don't discount your low-level headaches because they're not so disabling. When you're talking about the number of headaches you have per week or per month, include every day you don't feel normal, for lack of a better way to say it. Because if you short yourself, you're in your treatment. So go in, keep a diary if you have to, but don't just say, I only get 1 or 2 headaches a month, because the other 20 days of the month, I don't feel right, but I can function. Incorporate everything. It's the only way you're going to get the right answer. You're going to give the doctor or your healthcare provider the right information, and you're going to get the appropriate therapy that you need.
That's such an important point, Dr. Newman. So there's multiple phases of the migraine. There's the prodrome. For many people, this is fogginess, eyesight differences, sensitivity to light. Then there's some people get aura, which, could be for multiple symptoms. But then there's the headache phase, which most people count. And that can actually be limited to like 12 to 24 hours. And then if you add prodrome, which is the migraine hangover, like Dr. Newman said, it's multiple days of not feeling well. I mean, for me personally, that involves nausea, diarrhea, brain fog. I'm not able to string a sentence together, driving limitations. I mean, this is different for every migraine patient, but I can't reiterate enough what Dr. Newman just said, that it is more than just the headache phase, which does come unless you have abdominal headache, which I don't know if we're going to talk about that at all today, but, which is a GI tract headache, basically symptom. But you need to, as a patient speaking to you, and also as clinicians who are listening, that it is more than the headache day. It is multiple days of being disabled.
Yeah, thank you so much. And I know, Dr. Newman, I just wanted to say I was monitoring the comments, and there are plenty of people that have mentioned journaling as something that's really helped them speak with their doctors. So, and my guess is the American Migraine Foundation has a guide or recommendation for that as well. We have only a couple minutes left, so I'm actually going to go through the advocates, starting with Cherise, and ask, what is the one, in 30 seconds or less, what is the one thing you wish you had known going into this What is one thing? I'm sure there's many things. What is one thing you wish you had known, or what one piece of advice you'd like to give people starting with migraine as you went into your treatment journey?
One thing wish I knew going into the journey?
Yeah.
I mean, there's, like you said, there's so many things
that
I wish I would have known. But I mean, I guess I would just say that migraine is, as we've all stated here, it is a inherited neurological brain disease, period. Did not know that going into my journey. I just thought it was just a headache. That's what I thought it was. Didn't know that. And I've come to since know that that's not what it is. It's something that I inherited. And since being on this journey, I through research, I found that there's other people in my family that has it. And, you know, it's something that I have come to know that it's not my fault. It's just something that I just happen to be, you know, have. And it doesn't define who I am. And, you know, I've learned to thrive with it, you know, in here. We, like Dr. Newman just said, everyone on this screen suffers with that. And we all look amazing, but you can't tell, right?
You can't tell.
You can't tell.
No.
We all show up here every single day. We're all showing up every single day doing what we've been called to do. And no one can look at us and tell that we suffer with migraine. My advice to every patient, person that's listening right now, you can't give up. It's you have to be persistent and resilient. This is not a disease that kind of just, you know, says, hey, you know, I'm going to stop. It's resilient. It's persistent and resilient. So we have to also be. There's a lot of work that needs to be done in terms of research and advocacy, and we have to keep doing that work.
Thank you. And quickly, I'm sorry, I'm going to ask Kaitlin and then Rachel for their same feedback.
I think the most important. I
Sorry.
think the most important thing was I didn't get a choice whether I have migraine or not, but I do get a choice in how I manage it and what my life looks like.
Rachel. Oh, sorry, Rachel, you're still on mute.
Rachel, you're on mute.
Sorry, thank you. 30 years ago,
Okay.
I thought, you know, I didn't trust my gut, and I had braces, I had surgeries, I did things that I never should have done. I wish I trusted my gut, and I found a headache specialist. And Kaitlin, you are so right about everything that you just said about finding the people in your life that matter, and knowing it's not your fault. Like Cherise has also said, we're not a burden on purpose. We didn't choose this. So I would be kinder to myself.
Good advice. That's good advice for all of us, I think. Dr. Newman, any closing remarks? And then Dr. Lay, we're getting ready to wrap this awesome event up.
Well, I think the most common refrain we've heard is the one that I want your fault. It's not in your head. You don't deserve this. Number two is that there are people willing to help. And if you're not getting help, don't stop there. Move on and keep your journey going, because you will eventually find somebody who will help you.
I'll just add, yes, don't give up. We're all advocating and working hard, including our partners on the AHS side, to move the needle. And we are moving the needle. We have targeted therapies now developed based on science that is 40 years in the making. So we are creating drugs that will benefit people. And if these ones don't work, there are others in development. So just never give up hope and advocate for yourself.
Thank you so much, everyone. Thanks to our panel this afternoon for hopping on the phone or on the social with us and going through their journeys. Thank you to the doctors for taking time out of their day as well. I just wanted to let you guys know, or let people know, if you have any questions about today's programs or need any other assistance with your questions, please visit the American Migraine Foundation website at americanmigrainefoundation.org. You could also visit Medscape to see the programs that were presented at the AHS meetings this year, as well as other education, mainly directed towards healthcare professionals on migraine management. But there is education on how to work together, patients and doctors, to come up with the best treatment plan. If you'd enjoyed this session and learned valuable information, we do hope you will share the recording, which will be available on the Medscape AMF Facebook pages, YouTube, Twitter, Medscape, LinkedIn, I bet a bunch of other places. So please share. And with all of those battling migraine, any loved ones of someone battling migraine, we want to continue to serve the migraine community with programs like this and other critical education, support our patients now more than ever. Thank you, everyone, and take care. Have a great day.